Lorraine, you're on the air.
Thank you, Dr. Wallach.
Yes,
I'm actually on behalf of my husband. We're in our 80s. He's 82, and he has been diagnosed with Parkinson's in 2014. And we've been on your, I ordered the Healthy Brain and Heart Pack and some EFA and glucogel since the first of the year.
Okay.
And our representative that helped us with this called last week, and he said, well, the problem is, Lorraine, is you're underdosing, because I was going on the dosage that's on the bottle.
Okay, well, that's for prevention.
Okay. Well,
what does your husband weigh?
Anyway, he said 235 right now.
Okay, Shar, let's see here. What food group would Lorraine's husband need to take, even at 8 years old, and how much of it would you give to them?
He needs to be, he needs a lot of eggs and butter and stuff to rebuild the myelin in his brain.
Yeah, 235 pounds. You've seen a guy weighed 260 pounds, had terminal Parkinson's disease, and 3 months later is perfectly normal.
With no medication, exactly.
With no medication. Yeah, just how many eggs did he eat a day?
A lot. He said, I remember he talked about it, and he said he depleted the egg population in his town.
Which was what? Moose Jaw, Canada.
Moose Jaw, Canada, yeah. I think he was eating about 10 eggs a day, something like that.
No, he was eating 25 eggs a day.
But anyway, yeah, you need a lot of eggs to rebuild the myelin.
Yeah, 235, yeah, I'd have him take 18, 20 eggs a day. And they can be scrambled in butter, not oils or margarines. They could be soft poached with the soft yolks. They could be soft boiled with soft yolks. And that's the raw materials to rebuild the myelin of the brain, which goes away when you have these types of diseases, Parkinson's disease, MS, Lou Gehrig's disease, and Huntington's disease, and so on. And then what would you give this guy at 235 pounds as a supplement program?
Well, he needs 2 Healthy Brain and Heart Packs.
Okay, and what else?
I would give him the Ultimate Daily Classic, the Niacin Plus, and the Cardio Sticks also.
Okay. What would you give him for raw materials to make neurotransmitters?
I would give him the Synaptive and the Immortalium.
Very good. Okay. And so that's where I go. And, of course, you have to dose for body weight when you have a real serious problem. You need a bigger hammer, I call it, when you have a serious problem than if you're going to take something for a preventive maintenance. And so the doses on the bottles are for preventive maintenance, okay? And so this is why you have to read the books and listen to the CDs, talk to people who've been there. And we're so glad you contacted us, Lorraine. There's 2 reasons, Shar, why people will not see success with their longevity program for their health problems. What are those 2 situations?
They're not dosing properly for their weight, because the packs are all set up per 100 pounds of body weight. So anybody that weighs 200 pounds needs 2 of the packs a month. The other possibilities, they're not absorbing, and or a combination of both.
Yep. And so they need to be gluten-free. Your husband needs to be gluten-free. You need to be gluten-free. The dog, the cat, the bird, the fish, and so forth. You probably don't have a mother-in-law living with you if he's 82. And so this is imperative that all this stuff is followed, and get him the eggs, get him the supplement programs, and you're going to be very pleasantly surprised. You know, give it 30 days, you'll see something. I'm not sure, but by golly, he's doing better. Give it 60 days, 90 days, you're going to see something dramatic. We see so much good happening with Parkinson's disease, MS, Lou Gehrig's disease, Huntington's disease, all the dementias, Alzheimer's disease, Korsakoff syndrome, vascular dementia, Wernicke-Korsakoff, vitamin B12 deficiency dementia, and so on. And so these are the sort of things that we've been doing for 40 years. We have a lot of experience with them. And so please do avail yourself of these options. And, keep checking with your doctor and say, hey, I'm doing pretty good here. What do you think? Maybe you'll get the doctor to use these programs for their patients, and then we'll be able to help more people.